Carolyn is a patient here at Geisinger HealthSouth in Danville, Pennsylvania at Woodbine, and she had been diagnosed with some abdominal pain, a lumbosacral sprain, and her pain was so severe she could hardly move when she started with us. She was only able to do the treadmill at 0.5 miles an hour. Now she's doing it up to 2.2 miles an hour, and we do some exercises. So we're going to have you hang on to the bar. I'm going to bring you up a little bit. As part of her dysfunction, she has some really tight hip flexors. So one of the exercises we do in the pool is we have her take a step back, keep that back heel in place, it doesn't move, and she locks that back leg straight, and she'll bring her bottom forward, and she'll feel a nice stretch. So that's one of the stretches we do. Along with, you want to come over to this wall? We'll show them the hamstring stretch and the single knees to chest that you're doing. And it's so much easier for her to do this in the water. When you're in the water, yep, pull it in, yep. When you're in the water up to your neck, you only bear about 10% of what you weigh through your feet. And this water temperature is 93. This warm water relaxes your muscles, so it's much, much easier when you've had any kind of pain or dysfunction. It's much, much easier to get moving in the pool. The pool was really a great place for her to start her rehab and become more conditioned, help her overall well-being, help her get stronger and more flexible, and therefore she has less pain. So the other one is the hamstring stretch. If you can hold a stretch longer, the better off you are. And then go ahead and bring the other leg up, make that leg straight, pull your foot up. Good. Okay, so we did also, since her whole flank was involved, we also did a thoracic stretch. Go ahead and turn around, put your hands on the wall, and don't have your feet back too far. And that some patients call almost heaven because the stretch feels so good. It is a nice thoracic stretch. You really want to reach those fingertips and those arms out as straight as you can. And your bottom goes back, stretch, 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 head down. And again, you hold them 5-10 seconds. The longer, the better. Then we also do the trunk rotation. Come to the middle of the pool and hands together. I'm going to lower you down a little bit and turn side to side. Carolyn was very limited in her range of motion when she started with us. It took a few sessions until she was able to do her full range. So we, on the exercises, we do anywhere 2 sets of 5 or 1 set of 5 repetitions of all of them, holding them for 5 or 10 seconds. Then she'll come up to the bar, use the bar for some balance, and we'll do some strengthening exercises. But she also feels a stretch at her end range. So we want to strengthen as much of the pelvis and the core as safely as we can. So some of the exercises that we do are a straight leg raise to the front, down, back, down, paying attention to her posture, making sure head is up, chest up, stomach tight. And so Carolyn worked her way up to like 15 or 20 repetitions of those. Some heel toe raises. Then we bring Carolyn up out of the water a little bit. Again, when she was actually doing her full program, she would do many reps, many repetitions. The squats, head up, chest up, tummy tight. And I remember her saying how much easier it is to squat in the pool than it is on land. So we're going to go ahead and grab the hydrotones. Every time you move your arm, your abdominal wall contracts. So this is a nice way to also strengthen the core. So we have her rest her back against the wall. Okay, put the hydrotones facing down at your chest, and one of the first exercises we do, palms down like this. Push and pull, push and pull. And then a progression that we do is have her step away from the wall and do the hydrotones. The harder you push and pull, the more resistance you get. But we have no way of really measuring how much resistance she's getting. One of the other exercises is just shoulder flexion and extension with the arms straight up and down. And if you want, you can have your back against the wall for that, to stabilize you more so you don't cause any shearing forces on your spine. So that's extension and flexion of the shoulder. Then we also did horizontal ab and adduction, palms face each other. And then backhand with the hydrotones in the water. And again, as you get well and you can progress the patient, you can have them step away from the wall and they'll come up with a nice stance that keeps them stable in the middle of the pool. And then out here, palms facing down, down and up, half of a snow angel. So the hydrotones are really wonderful if you want to build strength for shoulders. And our session only lasts 45 minutes here. Each patient is one-on-one. Can you flip your palms like this? There you go. Down and up. There you go. You're doing terrific. How about if you go ahead and get rid of the hydrotones and we'll walk one more time. There was a day when she was really, really painful, and at the end of her session I had, go ahead and turn around. I had her, and it was mostly on the right side, the ribs around to the thoracic spine, and we just turned the jets on for a few minutes, and that gave her some really good relief after a good workout. This is a nice way to end the session for a minute or two. I'm going to have you walk again. Okay, ready to walk again? Can you believe you were up to 2.2? Isn't that awesome? I love that. There it is. Whenever you're ready and you feel like you have your center of gravity, go ahead and let go and very good. I'm proud of you.